Physical exam. The Department of Transportation, DOT, physical exams are regulated by Federal Motor Safety Carrier Administration, FMCSA, so that experts can attain or preserve a commercial driver's license and make sure that their driving enactment is not adversely affected and that they are all physically and mentally fine. The purpose of a DOT physical exam is to assess and test the complete health position of people. DOT test checks your body, psychological, and demonstrative health to ensure that you can carefully use commercial vehicles without putting yourself and others in danger. What is covered by a DOT physical? During your DOT physical, the examiner can perform check the following examinations: vision test, hearing, blood pressure or pulse rate, urinalysis, blood sugar level, protein in urine, general appearance, mouth and throat, back and spine, heart, sounds, murmur, hernia, lungs and chest, neurological exam, abdomen, joints, upper and lower extremities, circulatory system. Furthermore, the medical examiner may ask detailed questions about the medical history. Why do CDL drivers need a physical exam? Physical exams are prerequisites every 2 years to ensure the health and capacity of CMV drivers. The DOT physical exam is a public safety issue for the reason that if the driver is unhealthy and driving 5 tons or larger trucks may be unsafe. That is why a physical exam is needed for both public safety and driver's health. Who needs a DOT physical test? It applies to drivers meeting the following criteria: driving vehicles designated to carry 15 passengers, getting paid to drive a vehicle with more than 8 passengers, vehicles having 10,000 pounds gross combination weight. FMCSA requirements. According to FMCSA regulations, health examiners cannot declare drivers who have a DOT unqualified medical disorder or who use drugs or substances that damage the capability to initiate safely. Assured circumstances may disqualify you from a DOT exam, but it may be the doctor's decision. The situation must be thoughtful and adequate to avoid the driver from continuing driving duties. Applying the proper action or treatment can control the ultimate problem. Based on the harshness of the disorder, disqualification may be temporary. Drivers can be disqualified from the DOT physical exam on certain conditions such as high blood pressure, diabetes, visual injury, breathing dysfunction, epilepsy, and mental illnesses. What happens if you fail the DOT medical exam? In case you failed the DOT physical exam, you can reapply or submit a refusal to FMCSA for review. FMCSA will review your case by assessing your medical records, employment history, driving experience, and other appropriate information you provide. It can take up to 180 days to be given an answer. If you are temporarily disqualified, you can frequently appeal a retest after a few months. How do you prepare for the DOT physical exam? On your point, this is essential to gather medical information. In order to safeguard the flat growth of the exam, it is greatest to get ready before the exam. You should carry the following content into the exam: glasses, hearing aid, the latest laboratory results, letter of heart disease experts if you have heart problems, prescription medicine list, including dose scheme. Your prescription doctor's name is in writing, doctor's office address and phone number. goMDnow conducts DOT exams at their specific DOT compliance centers. We also help our clients to get all the required documents and assistance throughout the DOT exam procedure while providing additional medical information and a qualified DOT physical health examiner. Thank you for watching.